Welcome back. Today we're discussing what to expect in the first 24 hours after birth. If you're new here, my name is Jamie. I'm a midwife. I've been attending births for over a decade. Today we're going to discuss what happens in the first 24 hours after you give birth. So initially after birth, the baby is placed on the mom's chest for skin-to-skin time. This helps the baby transition to life outside of the womb, and it's where it can be assessed to determine if the baby is well enough to stay with mom or if it needs to be taken over to the warmer for extra attention. During this time, you'll notice your baby start to look around, cry. You'll notice their skin pink up, though it is normal that their hands and feet might stay a little bluish, purplish for the first 24 hours, and that's totally normal. That's part of newborn circulation adjusting. So the baby stays on mom, and during this time, they will offer to clamp and cut the cord. Now, if you're doing delayed cord clamping or optimal cord clamping, your provider should be waiting at least 60 seconds to cut the cord to ensure that the baby has received all of its blood. Ideally, you want to wait until the cord is limp and flaccid. During this time, your provider will attend to the delivery of the placenta and assess for tears and if they need to be repaired. If you've had an epidural, you may not be aware that this is going on. If you have not had an epidural, you're going to be more aware. If you had a tear and it requires sutures and did not have an epidural, they will give you lidocaine beforehand to make sure it's numb so that they're not causing any unnecessary pain. During this time, they will also feel on your uterus to make sure that it is clamped down and contracting, because that is what's preventing bleeding after the birth. And they will continue to do this for about every 15 minutes or so for the next couple hours until you are moved to the postpartum room, where the checks will continue to happen less frequently. So it's not uncommon for moms to feel this like shivering, shaking feeling after labor. Some experience it, some don't. If you don't know about it, it could be alarming that it's happening. It looks like you are freezing cold, like someone just dropped you off at the North Pole. But what is actually happening is your hormones are just plummeting from all of the excitement and activity, everything that just went on in labor. And so they're just re-regulating. And also you did have this internal heater who is now on the outside of you. The nurses may offer to grab some warm blankets to help adjust to this period. Also, drinking some juice can help, and a funny little trick is you can try sticking your tongue out and biting down on it. Hey, I didn't make the rules, but it helps. If the birth is unmedicated, no epidural, no narcotics, no pain meds, or if you've had pain meds and they've worn off, typically a baby will have a quiet alert phase when it is born, and that can last up to 2 hours, where they may initially cry at birth, but they're looking around, they're alert. This is a good time if you're planning on nursing to try latching the baby. They don't necessarily need to be latched immediately, but it's ideal to do it within the first hour if you're planning to breastfeed. And often the nurses are really helpful to provide support with suggestions, support positions. A lot of hospitals have lactation consultants on hand now, but it may not be possible to see them until you're moved to postpartum, and even then it could be the next day before you're seeing the lactation consultant. Now we're going to talk about something that's really important, and not everybody talks about it, but not everybody falls in love with their baby right away, and that's totally okay. I'm sure you've heard friends or family, oh, from the moment I saw them, they were the most beautiful thing I ever saw. And like, yeah, some people have that experience, and that's great. Like, that's not uncommon, but also that's a new person, and they're kind of weird looking, and they're kind of squished up, and they're awfully demanding, and you're exhausted. And it's not, nothing is wrong with you if you don't look at that baby and think, oh my gosh, you're the most wonderful thing. Like, it may take a few days or weeks or even months, and that is totally normal, and it's nothing to be ashamed about. What to expect out of the baby. After they have that quiet alert phase for the first 2 hours, they are going to crash hard. They are tired, they are exhausted. As much work as you did, they were also going through it on the inside, and so it's not uncommon that they are extremely sleepy the first day. Now, the two things that I like to point out with this is, if you are planning on nursing and you are trying to nurse them every 2 hours, they're gonna be sleepy and it's gonna be hard, but it's not because they're a bad nurser or you're bad at nursing. It is because they are still just exhausted, and it probably is gonna be a different situation once they are more alert and have more energy. And the other first-time parent trap is that you think your baby has their days and nights figured out the get-go. And while I really do hope that you got a great first night of sleep, it is not likely going to be the situation moving forward, but it's not impossible. For the first few days, babies will have this black, sticky, tarry poop called meconium, and Once they start eating more frequently, it will transition from a green to a yellowish texture that's a lot easier to clean off. In the first day or two, they don't have very many wet diapers. It's not uncommon for them to have 1 to 2 the first day and 2 to 3 the second day. So things to keep in mind: as they begin to eat more frequently, that will increase over time. Routine procedures they do at the initial newborn exam. So this is ideally after skin to skin time, you've had time to bond, you've had time to nurse. They'll take the baby over to the warmer, and there they will weigh the baby, they'll measure the baby, check for reflexes, make sure that everything is intact, make sure they've got all their fingers, all their toes. They will offer 3 routine procedures, and that is vitamin K injection, hepatitis B vaccine, and erythromycin eye ointment to prevent infection. All of these things are optional, and I highly recommend researching beforehand so you know what is best for your family. Routine testing that happens before the baby is discharged from the hospital are a metabolic test called the PKU, where they prick the heel and take 5 drops of blood, and that is to test for disorders with digesting proteins, as well as a couple other things like thyroid levels, sickle cell. Very rare, but important to catch early on if they do have them. And then a hearing screen. Often they will also do a jaundice test that they may prick a heel for if necessary as well. All right, so after giving birth, you typically will spend about 2 hours in the labor room before you are moved to the postpartum room. It could be longer depending on availability or various reasons until you're stable, but that's about the general rule. Something that's important to know before going into labor is if you give birth in the middle of the night, it's very possible the cafeteria will be closed and you will not have access to fresh food. And births happen a lot at night, so it is important to plan accordingly. So bring some hearty snacks that you would like to eat because you are going to be ravenous. You have worked very hard and it's likely you have not eaten in a long time at this point. Or if it's getting later in the day, maybe calling in friends or family to stop at your favorite restaurant and pick up something that you can eat later that evening. The first day, you're going to continue to bleed pretty heavily, and you may lose clots as small as a quarter or even as large as a lemon, and that's not uncommon. Some other changes that may be likely happening in the first day as well as the next couple weeks: you are going to pee a lot. You have had all this extra fluid to support this baby, and now you don't need it anymore, and so your body is going to be getting rid of it in large quantities, either in urine, or you are going to notice some women have a lot of night sweats. That's as their hormones are adjusting as well, and again, a lot of excess fluid to get rid of. So you will continue to bleed for up to 6 weeks, but the amount of blood will taper off dramatically in the next day or two and be more of just some like lighter days of your period for the first week and then some spotting. It may take a few days to have your first bowel movement. So if you recall, during labor, you usually clear out, even prior to labor, your body is clearing out all of your poop and stool, making more room for baby. A hormonal shift will cause that to happen. But not only is that happening, but your digestive tract is slowing down and you have likely had an extended period without food. So don't be surprised when it takes a couple days. Also, don't be terrified. Your provider will likely offer a stool softener, and that's really not a terrible idea, especially if you are starting to dread that first post-birth bowel movement. Once you move into the postpartum room, you will have a nurse coming in frequently to check on you and the baby, doing your blood pressure, feeling your belly, assessing your bleeding, checking the baby, making sure the baby is eating. Most hospital protocols for a straightforward vaginal uneventful birth, if there's no issues afterwards, will discharge moms within 24 to 48 hours. Now, there are some exceptions to this if they need to observe the baby for signs of infection or even mom after birth, but that's what you could typically expect for an uneventful delivery. So one of the things that is common now in hospitals is the baby friendly initiative, and that is to help support women in breastfeeding and bonding with their babies. If this is the type of hospital you are planning on delivering at, some of the things to know beforehand is they often do not have nurseries. They do not give babies pacifiers because they want to encourage nursing rather than giving pacifiers, and they often have lactation consultants on hand. These are worth knowing before you go into the hospital. That way you know what to expect as far as if you want to bring pacifiers, If you want the baby out of the room, you want to rest and recover and would feel more confident if somebody kept an eye on the baby, you can ask a nurse, and often there will be a place that they can take the baby to have a break, but they are not generally put into a nursery like you often have probably seen in movies or old days where there's a room with a bunch of babies. That covers today's episode of what to expect in the first 24 hours. If you have given birth and anything surprised you, I would love to hear about it, so leave it in the comments below. See you soon.